Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello, Dr. Natalie Keith.
Dr. Josiah Dame.
And it's Vet Tales again. Mm-hmm. Exciting. First thing in the morning, coffee in hand. Where's your coffee?
Don't have it.
What?
It's been a morning.
It has been a morning. Yeah, we have to do, we love that client education stuff, but it's happening simultaneously with like real sick animals.
Yep.
It's where we get the tales from, guys. Anyway, so today we're going to have like a little bit more of a lighthearted topic, because this is not something that's like life-threatening, but it is something that's
It's frustrating.
Infuriating.
For clients and vets.
And staff.
Yeah. I always have to like caveat to clients. I'm like, this is frustrating for everyone involved.
Yes, if you feel frustrated, don't feel alone.
Yeah. It's like we feel the same way, because in theory, if I could just fix this and this be over, I would choose that.
The magic wand approach.
Yeah.
Yeah. Everybody wants the magic wand approach, but unfortunately. Okay, so I know you're dying to know what we're actually talking about, which is ears.
Mm-hmm.
Chronic recurrent otitis externa.
Ear infections.
Over and over again.
Yep.
Woo.
Constant.
Yep.
And so with ear infections, a lot of people are like, why me?
Yeah.
Why my dog? And there are actually things that make your dog more susceptible to ear infections, just like being the breed they are. So we see a lot of golden doodles.
Yeah.
We see a lot of labs.
Yeah.
And so reasons is conformation of the ear. So like a floppy ear is going to have more issues, because you're not a shepherd that's getting airflow directly down the ear canal all the time when they point their ears certain directions, versus an ear that's flopped over and it's trapping in a lot of moisture and not getting dried out.
Yep.
Hair in the ear.
Your poodle guys are all going to be in that category. They just
so much
it's like
hair.
a carpet in there.
Yeah, and so that traps moisture.
Yep.
And then you have some dogs who are born with really, really small ear canals.
I see that a lot in the pits too, and then of course you're like Frenchies.
Yeah, exactly. And so with those, same kind of story. You're not getting airflow down the ear. It's not getting dried out. So then you create a really moist and warm environment.
Love that. I love
moist and warm environment for yeast and bacteria.
It's like a little party in there.
Yeah,
a little party.
They start to throw around. So that's like our common breeds. That's our common breeds that I feel like we end up seeing for ear issues that do become chronic. And of course, there's other things that contribute to ear infections too.
Yeah, the big one.
Yep.
The big one is allergies.
Yes.
Can be environmental, but certainly is many times food related.
Yeah.
Or even both.
Both, I think, happens a lot. But
in the same pet, that is. Obviously it could be both in any pet, but also it could be both in the same pet.
And anytime that someone comes in with an ear infection and it's like a 2-year-old golden doodle,
you're like, buckle up.
Yeah, I kind of...
It's going to be a long ride.
Yeah, kind of. I go, okay, so is this our first ear infection? Yes. Okay, well.
It's not your last.
I'll say, hopefully it's one off.
Yeah.
And if I see you back in a month or two with another one, then we're going to start talking about some lifestyle changes, like maybe food changes, because more often than not, they do need that diet change. And it's really frustrating when you're 7 in and then you change the food and then you fix it. So I will almost maybe jump the gun with the food trials first, after that second or third one, because I'm just like...
Yeah, the first ear infection, you go, is exactly what I do. It is, okay, well, hopefully this is the last one.
Yeah.
But probably isn't. And so here's what I want you to start thinking about.
Yeah.
Is, allergies, food trials, ear maintenance, and things like that.
Yeah. Those are the big things. Now, if there's
you can't also, let's just talk about ear mites for 1 second.
Yes, I was going to say.
If you're a cat, you might have ear mites. If you're a dog, please tell your owner it's not ear mites. I know you think it's ear mites, but it isn't. It's not ear mites.
Yeah, and we have this beautiful thing now called isoxazoline preventions.
Oh, yeah.
Which are going to be your NexGard, your Brevectos, they kill all those mites.
Yeah.
So it is not the same issue that we saw.
Most of the cat
10
topicals
years
are the
ago.
same way, like Revolution as well. Like it does all the ear mites, which is nice. And
It is so nice. It's
you do
not
see it
the same issue.
In feral cats, you'll still see it occasionally, but with dogs, it just, like, I have been, between teching and being, like, an actual veterinarian and a student, everything in between, I have been at this for 21 years now. And I think I've seen 3 ear mites in dogs.
Yeah. It's not common.
No, and I've seen a couple of the ear ticks. Those things are so gross.
Yeah, really
Blech.
gross.
They are weird looking little things.
Most commonly, it's going to be just allergy, ear infection secondary to allergies.
Secondary to allergies is by far and large. I read a study once that
Plus
said,
confirmation of your dog's ear.
Yeah, luck of the draw, like on genetics or whatever. But I had a study one time that I read that said that in dogs with food allergies, in 85% of dogs with food allergies, the only symptom that they had was chronic recurrent otitis externa.
Mm-hmm.
So I don't know if that's still accurate, because that's been like a while ago I read that. But the point is that
Most common.
people are, I think it's such a far removed concept. People don't want to say, you know, oh, food allergies make dogs' ears itch. Like, that doesn't make sense. You know? But it does, in the sense that we know allergies create a lot of itching in dog skin, more so than us. Like, if we eat food that we're allergic to, we're likely to have GI signs, but not always. Like, you know, runny nose is a very common symptom of dairy allergies. And my daughter had a dairy sensitivity that was really wild when she was a baby, would break out in a rash. So it's not unheard of.
Yeah. I think people are coming around to that, though.
Yeah.
Because I have eczema.
Yeah, I was going to say, are we going to talk about it?
Just to throw that out there.
Are we going to talk about it?
I have eczema.
Yeah. I was like, can we tell them all the diet trials I've recommended for you? Yeah.
The amount of people, not just Dr. Keith, that are like, cut out gluten. And I'm like, no.
I'd rather just have
I'd rather have eczema.
I mean, and that's a choice, man. Like, yeah, that's totally you. And some people choose that for their dogs, too. But essentially, I think back to my original point was that the ear canal is just an extension of skin.
Yes.
So when we talk about ear infections in dogs, it is wildly different than an ear infection in humans. Like, if you got kids, babies, and they get ear infections, we're talking about internal ear infections, otitis interna.
Which can happen, but really uncommon.
Yeah,
I maybe see one a year.
And the symptoms are so much different.
So different.
Yeah.
They're falling over.
They have
they're
head
neurologic.
tilts. They've got a fever. They don't feel good. And these dogs just have, the ones that we're speaking of, this is the inner ear skin. And so it's happening on the outside of the eardrum, if you will. So in the canal and up the pinna of the ear, which is the flappy bit.
Yep.
And it's a skin infection. And if we can I know this is a little awkward, people, but the most common thing that it would be like in people would be like a yeast infection that women get. That's really the most common likeness, because a lot of times ear infections in dogs are yeast based.
Yes.
So your symptoms are going to be really similar.
Yep. Red.
Itchy.
They're going to be flopping their head a lot.
They'll scratch their ears so hard they make themselves bleed.
Yes.
And then the hematomatoes, as I like to call them.
The hematomas.
Hematomas, they get little...
Yeah, the ears that blow up.
Yeah, so essentially what's happening is that, and this can happen in a trauma incident too, like a dog fight, for example, but they'll be shaking their heads or scratching their ears so violently that the skin separates or pulls away from the cartilage in the ear. Because you know how your dog's ear isn't just skin, like you can feel the kind of stuff in the middle there. That's cartilage, and it pulls away, and the body's like, ooh, free space. What do I do with that? And so just start shoving. Yeah, a little bit of blood there. It'll be fine. It's just like, that's like me trying to fix the holes my dog digs in the fence. Put some bricks there. It'll be all right. That's how I fix it. And so the body is just putting fluid in the space, bloody fluid, in order to try to, I don't know, bandage what's happening, but then what will happen is the fluid then keeps the skin from being able to adhere itself back to the cartilage, so you actually have to keep a drain. Surgically correct it by draining the fluids and tacking it back down to the cartilage.
So it heals flat, versus if you let it go, which I personally have had a dog with double hematomas that we just kind of let resolve on their own. And they get a cauliflower ear is what they call it in wrestling. So they kind of look like a crumpled up Dorito.
Yes.
Yeah.
Uh-huh.
And so...
And they can be really painful. And can get
we don't
infected.
recommend that.
Occasionally it's warranted.
So another thing is it changes the conformation of your dog's ear. And so
Thereby
after they get that hematoma, if it was from trauma and not from like an ear infection, they're at a higher risk of getting ear infections, because sometimes it even involves the bottom portion of the ear near the canal, and can even make the canal of the ear tighter and smaller.
Yeah.
So,
which is why it's so important to address these things quickly, because that scarring in and that stenosis, as we call it, where the ear opening gets tighter and smaller, it just is going to make the next ear infection easier and easier and easier. Yeah. So the sooner you jump on a maintenance plan, because you could not do anything about preventing, but what you're going to have is very frequent vet visits, or a dog with very painful scarred ears that, and they can even end up in what we call TICAs, which is a total ear canal ablation, where they actually go in and remove the entire ear canal, so the dog's head shut, as if there were not an ear there to begin with, which is like what nobody's goal is.
No, they leave them like a little opening, but it's weird.
It is weird, and sometimes, it depends.
And it's worth it. If your dog is at that point, it is worth it.
But. It is worth it, but it is a referral surgery. There aren't many surgeons that do them, and there's just like, ideally,
it's not fun.
No, but the Cocker Spaniels, I've had a couple of Cocker Spaniels that no matter what anybody did, they just wound up with a TICA.
Yeah.
By the time they're like 8.
And I had one with the TICA, and it still had issues.
Dang
which is like how, but...
Well, so like the TICA that my last Cocker had, they closed it completely. They removed the entire canal, and he never had trouble again, but his name was Jack, and he was obviously deafer than a doornail. Mm-hmm. So if that's an expression, is that right?
I don't know.
Okay, let's go with it. Could not hear anything. He had no ear at all. So, anyway, and then the other time I've seen it were people who have rescued an older dog, like off the street or out of the pound, and it's just like the damage is done.
Yeah.
So, but let's go all the way back. Let's go back to, as we tend to do, we tend to go through circles.
We went all the way to the end.
All the way to the end. Let's go back to the beginning again. Where does this start? What do you know you're looking for? When do you go to the vet?
Yeah, you go to the vet when you start to see your dog bothering their ears, or
the funky smell.
The funky smell, or probably before they start bothering their ears, you'll just be like petting their head, and then they lean into it and they yelp.
Yeah.
Not necessarily the leaning into it's fine because they're enjoying like a head rub, but like if they're painful when you push a little bit on that ear, then maybe there is an ear infection setting in.
Yeah.
But.
Yep. And sometimes they'll. You can, when you look in the ear, it'll be red, and sometimes there'll also be like a lot of just gick in there. I like to call it gick. Exudate would be
black,
a proper.
Brown,
tan, waxy, wet, anything like that.
Sometimes purulent, which is pus.
Yeah, purulent exudate. And so that can even be kind of whitish or tan, creamy color. It's so pleasant, but at that point, your dog's ears are going to smell.
Yeah, and
like you're going to not miss it.
You bring them in.
Yep.
We do an ear cytology.
Yep.
The reason why we do that, and we do it every time, is because it's a way for us to monitor therapy, 1, and 2, find out kind of what we're dealing with so we know what to throw at that ear.
Yeah.
So we will typically see, and we'll throw it out there, we'll say we saw cocci, rods, or yeast.
Or all three.
Or all 3. Or 2. But those are general terms. So rods is just the shape of the bacteria. Cocci is just the shape of the bacteria.
Yeah,
it's not a specific bacteria.
It's just it's like a class. I mean, I don't know if you used to say class, but it's sort of like saying like I saw dogs or I saw cats.
Yeah.
They're mammals, whatever. So these are bacteria, but they tend to behave in similar ways regardless of which rod or which cocci it is, especially with cocci. The rods can get a little waspy, but
they can.
But as far as that, the reason we're distinguishing them is because they tend to respond to therapy in particular ways. Coccis tend to respond to this, rods tend to respond to that, yeast responds to antifungals, and so forth. And so that's really why it's important for us to identify those.
Yeah, and because cocci and yeast are commensal, which is a fancy word to say they're always on our skin. Just sometimes they get out of hand.
Yeah, it's about population management.
Versus rods you shouldn't have them in your ear.
Yes, and rods are scary because they can be resistant.
They can create biofilms,
biofilms is that waxy, weird stuff we were talking about.
Blah.
It is blah, and it's difficult then because it's like it's like putting this sealant
A saran wrap
around them so that your medicine can't get there. Yeah. And so you've got to get the saran wrap broken down, if you will, in order for your medicine to even get to the little germy guys.
Yeah. If any topic frustrates me, guys, it's this one. And so if I get fired up, because it can get so frustrating.
It is so frustrating because, and then like, I think owners will come back and they'll say, what you did didn't work. She was better for about 4 weeks and then it came right back. And I was like, well, right. Because what we did was we treated the infection and that medicine lasts about that long. Mm-hmm. And as soon as the medicine that was preventing the disease was gone, then the underlying condition just took off again. Yeah. And so it's so frustrating from our perspective because we don't want you to keep struggling with the same problem either.
Yeah.
And it can be, like, especially with rods. Oh, so, like, what about cultures? Because we've talked about that. We've gone kind of around on the value of actually... So, the difference between cytology is we just use the Q-tip, swab the ear, look under a microscope, and we can see the cocci, the rods, or the yeast.
Yeah.
But with a culture...
Cultures are difficult in ears because... It's not the way cultures are set up. They're for antibiotics that you're taking, orally or injectably, and so it's not necessarily telling you the spectrum of topical effect. But in certain situations, it may be helpful to figure out what kind of rod bacteria you're dealing with.
Right.
Are you dealing with I'm going to throw out some words. Are you dealing with E. coli? Are you dealing with Pseudomonas? So though it's not something we reach for often to do a culture on an ear, we sometimes do reach for it because it may guide our treatment slightly.
When they're not responding to what we would normally do in that situation and the rods are kind of just flying in the face of
when it's like the fourth time you've come in and there's pus coming out of the ear,
it's enough.
Yeah, enough. I might be like, let's call a dermatologist and let's send out a culture just to see what this is.
When the normal reasonable things are not getting you a response. And there can even be things like, there can be especially in older dogs, a tumor down in the ear that's not allowing the normal movement.
Yep.
Because all of us have, a normal amount of wax in our ears, including dogs. And there's this movement happening constantly where that is being kind of elevated up and out.
Yep.
And whenever you have a abnormality within the canal, like a growth, let's say, then it hinders the escalator or escalator, not an elevator. The one with the stairs.
Or the walkie ones at the airport.
Or the walkie ones at the airport. Do those have a name? Someone please let us know.
Sidewalks.
Fast sidewalks. Motorized sidewalk.
Motorized sidewalk. I really like them.
Okay. Let's find out later if there's a name for those. And if not, we're going to suggest some names for motorized sidewalks. Anyway, so that's what's happening in the ear. And so if there's, obviously this giant thing in the middle of it, you're not going to be able to move that debris normally to the outside of the ear, and it's going to build up. And anytime there's a buildup of that stuff, that's how our bacteria start proliferating.
Yeah.
Or yeast, as it were. Are you Googling it right now?
A moving walkway.
A moving walkway. All right.
Moving sidewalk.
A moving sidewalk, yeah.
Moving auto walk, moving pavement.
Oh, so there's a lot of names for it too, which means we aren't really settled on anything
In British
yet.
English, it's called the travelator.
No, a travelator? Oh, that's amazing.
Maybe we snort. Moving walkway.
My favorite thing about England is right before you get on to the transportation, like the subway or the the train tram, whatever they call it. It says mind the gap.
Yeah.
Yeah, you better. It's a doozy if you go down.
In the tubes?
In the tubes, yeah. You don't want to fall. Mind the gap. I don't know why that's so funny to me. There are people in England being like, y'all are dumb.
No, I think it's a thing. Because, there's stickers that say, mind the gap.
It is. I mean, I remember, I didn't know it was a thing, and yet it became a thing for me instantly. The first time I looked down and saw it, I was like, yep, duly noted.
And then you go to New York City, and you're just like, what's going on down here?
No doubt.
It's random, but in one summer, I went to, this was after my first year of vet school, and I graduated that year from undergrad. I went to London, New York City, in like Copenhagen in like a month.
Yep.
And I went, after going to Copenhagen, to London, but going to New York City after those cities, I was like, oh, it's like this. I'm not trashing New York City, but the subway situation was very different.
Yes, the subway situation is very different. Anyway, we digress. Elevators in the ear.
Yeah.
I mean escalators. I mean moving sidewalks.
Yes.
Okay, so back to our patient. We have now decided what infection we have. We are going to put them on, depending on what we found, different types of medications and or cleaners.
Yes.
So, what are your thoughts? Can we just talk about ear cleaners for a minute?
Yes.
Let's do it.
I have
Do
a
not
lot
put
of-
apple cider vinegar in your dog's ear.
Don't
please.
put peroxide in your dog's ear. Don't put apple cider vinegar in your dog's ear. Yes, like I know that peroxide there are peroxide even for humans' ears, but it's not your 3% peroxide that you have in your cupboard. It's a different percentage, and it does not disrupt the cells like the 3% does. But we have medicated cleaners that we recommend. Most commonly, I will reach for, if your dog has an infection, one called Triz Ultra, made by the company Detra. The reason being is the
biofilm.
The biofilm, and it breaks down the biofilm, and the Triz portion of it kind of pokes holes into the bacteria and allows the medications to hit the bacteria a little bit easier.
Yep.
It's the easiest way to describe it.
Yeah. And then let's say you just have like a basset hound or a cocker that needs routine ear cleaning just for maintenance. You probably should clean those ears, I would say, twice a month.
Mm-hmm.
I like to use Phenotics or pH Nautic, whatever. It depends on, where you come from, how you say it. But it also has that hole poking effect. And it has a nice drying agent in there. It's pH balanced, which is why they call it pH Nautic.
Mm-hmm.
And that way it doesn't burn the dog's ear.
Mm-hmm.
And then the drying agent, so it doesn't just sit there moist in there again, which is what bacteria would love to have happen.
They love that.
And so, so that's a really great one for just routine maintenance. And then the Triz is great for those yucky ears.
Yucky ears. And so we have kind of 3 to 4 medications that will rotate through, depending on kind of what's going on with the dog, the family sometimes. So like if you're an owner that is not going to be able to put the medication in the ear every day for 5 days in a row, which happens, then we'll pack the ear with packing medications, that sits in the ear for a longer, and you don't have to necessarily do anything. You don't flush the ear, versus if there's a really bad rod infection, then I will kind of be like, I'm sorry, but I can't pack this ear, because what I want to do is flush. An hour later, put in this exotic medication, which is a gentamicin-based medication, and then, recheck in 2 weeks and see what the ear's looking like.
Yep. And sometimes they go on orals as well, especially for dogs that have that exudate, that purulent exudate or the pussy ears. Yeah. That means that we've kind of gotten an infection, not just otitis externa, but otitis media, or in the middle of the ear, which is still on the outside of the eardrum, because that would be the interna. But those dogs need an oral antibiotic. Depending on if it's cocci or rods, it will change which antibiotic we use. And then often I will give them a short course of steroids, because the steroid will dry the ear out, which again is dry is the enemy of bacteria, and then relieves the swelling, which helps again get our moving moving sidewalk going. And then we also want to get rid of the itch, so they quit traumatizing themselves.
Yeah.
And it kind of gets to the heart of it, because a lot of these dogs are allergic. And so we do have like Apoquel and Cytopoint for allergies, but those do not work well for food allergies, which many of these dogs have. So when I'm trying to do damage control, I start with the steroid, and then I say, okay, we're back to a maintenance.
Yeah.
Can we maintain on Apoquel or Cytopoint? Which is why your rechecks are important. Please don't skip them.
And potentially, let's switch that food, because it does take a minute for the food, to your dog to respond to the changes in the diet.
If you have any of this going on, please, when you get done listening to this, go back, if you have not yet, and listen to the infamous food trial episode and the itchy pet episode, because both of those are going to be really helpful for you.
Yeah, they all overlap.
Yeah, they do.
And then with sometimes I'll just have a dog that doesn't have that bad of an ear infection, but the external pinna, which is the fancy word for the outer portion of the ear, is
the flappy
just
bit.
so red and just mottled
Swollen.
and swollen, and so and even pustules can be on that. Sometimes I'll send orals with them too.
Absolutely.
Obviously not my like big ones that I would use for the pus-filled ear, but I'll
something
send
to
something.
get under control.
And you know, if the canal's normal, I may just do Apoquel for the external pinna dogs and not jump to the steroid. But yeah, most often in years I'm reaching for a steroid.
Yep. Yeah, and another thing to look at, like if you're wondering about your dog, is like you were talking about the pinna and the skin, the way it will change. Sometimes it will start to look what I call it is cobblestones or elephanty.
Mm-hmm.
If that's a word I made up, elephanty.
Yeah.
If it looks like with the creases and the thick, that tells you you've got some degree of chronicity.
You got a problem.
You do have a problem, and it's been there a minute.
Yeah.
So, and maybe just like simmering low. You know, some dogs will just like blow up.
Classic Cocker Spaniel is the cobblestone ear.
For sure.
Where you're just like, all right.
Yeah, of course you do.
In 3 years, we'll put you on the books for the Tika.
Yeah. Because you're going to swim up current, no paddle.
Yeah.
You don't even have a boat. Like, this is happening. And it's you know, also every Cocker Spaniel, I like to plug insurance, you know, every couple episodes. If you have a Cocker Spaniel, get them on insurance when they're 8 weeks old, because if you wait till they're 12 weeks old, they might already have an ear problem. Now it's pre-existing. And also make sure your insurance doesn't exclude breeds based off their diseases. So like some will be like, Cockers aren't covered for ears.
Tricky.
Boxers aren't covered for cruciates or hearts. Yeah. Man. Watch that fine print. Watch that fine print. Pumpkin is a good one. Pet's Best is a good one. Trepanion is a good one. They don't breed exclude.
What's the website that you can shop with?
Oh, yeah. It's called Policy Advisor. It's PAW, like a paw.
Mm-hmm.
LissyAdvisor.com. So it's like Travelocity for pet insurance.
Nice.
Yeah. So, yeah, because we're not insurance salespeople. I just have watched some policies come through.
We don't get a kickback from these companies.
We do not. 100%. We don't even get I think we get like a 10% discount on our own policies, even though, like, we charge ourselves cost for stuff. So
there's no point.
It's so brutal on our end. But for you guys, it can save your bacon.
Yeah.
Anyway, okay, so in general, most dogs do not need their ears cleaned routinely unless your dog has ear problems, or you have a breed that's specific to that, like the Basset Hounds and the Cockers.
Mm-hmm.
They actually don't recommend ear plucking hair anymore, because it just increases inflammation in the skin. So back in the day, they used to say, get the ear hair out. Now they say, leave it alone. You can, I think, trim it, you know, so that it's not like catching as much moisture. What are you giggling about?
I'm just laughing at taking like a ear trimmer to the ear.
Yeah, it's
like an old man
like the ones they put in their nose.
Ears.
Yeah, like that. I think the groomers like just use their little detail trimmers is what's going on. So you don't have like this super long hair protruding out of the ear canal, because it traps less moisture, and then you're also simultaneously not causing trauma to the skin by yanking all of the hair out. Yeah. So it's like getting, you know, waxing your legs. Like, it's not. I've never had that done, but I hear it's painful. Just saying. When you try to extrapolate veterinary medicine onto people, sometimes it gets weird. Oh, that's Jessica, Dr. Estep and I were talking about it yesterday when I had a client lift up her shirt and was like, "Is this ringworm?" I don't know.
You have to go to your doctor.
Go to your doctor. Your cat has ringworm. I don't know what that is.
See your doctor.
You are the one species I am not responsible for.
That happens more often than you think.
Oh, it happens all the time.
People show me a rash and I go, you will have to go see your primary care.
Yeah, I mean, we do deal with zoonoses, or zoonoses meaning things that spread to people, which is a tangent, but we're already
all we
here.
Can say is
this could potentially be contagious to you.
Yeah, go see your doctor.
So go see your doctor. Yeah.
I agree that rash is suspect. Go see your doctor.
Regardless of whether or not it pertains to your pet, that does seem like it needs medical intervention from a doctor.
Yeah.
That is for humans.
You know, I think only one hand I could fill with those stories, but that's a lot.
Give it a minute. Yeah.
Just the one hand soul.
I have some that are way less pleasant running through my head right now. Anyway, okay, all right. So I think that's ears in a nutshell. Again, food, infamous food trial, and itchy pet. Those are great episodes to refer back to. If you have a dog with chronic otitis externa, do not feel alone. It's a really common condition, and it is a process, and it's lifelong management. So, anyway, buckle up.
Buckle up.
All right. Okay, that's it, guys. Yay! Bye.